Welcome to Bite Size Dental Marketing. Today I have the one and only Ian, the South African,
It's
the
been a
dental
while.
master. Yeah. Dental marketing, South African prince.
Send me money. That is one of the jokes that I've enjoyed making with our clients again and again. When Andre would go, so if you get an email from South Africa saying that they need access, it's not the prince from Nigeria trying to get your money. It's Ian. So, so I always enjoy that one. It's funny.
What are we going to talk about today?
Something very important, Eric, that I think many dental practices don't put enough weight behind this, and that is the front desk, the guardians of our dental practice galaxy.
Now, I've heard, as we've done these podcasts and things, that even the term front desk diminishes it. Are you into the, I don't have problems, I have opportunities? Are you into the language matters of life? I'm not. I have problems, and yes, sometimes
And I
there are
deal with it.
opportunities, and I deal with them.
Yeah.
But I don't get hung up in language. Now, are you like this language matters? The front desk, is that are we out of the gate diminishing them?
I would say that regardless of how you phrase it, the weight that you put behind it will change that. So I can say my executive calling answer front desk money making person. I can call it that, and everyone's
My
like,
VP of
"Wow,
sales. My VP of
wow, that's
sales.
amazing."
Yeah,
Or I have a culture in my office that understands the term front desk means that's where the magic happens. This is the magic area right here.
The words don't matter. The inflections, the body language, how we treat them, and that's my view on it. Now, obviously a lot of people make a lot of money being like, you don't have problems, you have opportunities.
And today we are going to play a bit of that role so that we can teach dentists about how they need to be thinking about the front desk and what that term needs.
Well, I mean, I think let's just jump into culture. I think culture matters. If the primary employees in your practice are like, oh God, the front desk, I would never work there, or they just little snide remarks, even if they're well-meaning, paint a picture of how much you do or don't prioritize that front desk. And it kind of makes me think of here at our agency, that primary account person, right? That top account person that our clients have, that has historically been the most challenging position in the agency because it's our version of the front desk, if you will. They're
And
having to
we've
feel,
tried to give it many names.
and we've tried to give it many names, and we've given it many people.
It's not client services. That sounds too. It sounds too generic. And it's like no. It's the what was it? The surprise and delight team, or the what was it? The love squad. And I remember we've given it so many words. But one thing, Eric, that I think I've taken from our experience that I want to share with dentists is the role that yourself, as a leader in this organization, along with Andre, have curated the idea around what it means to be client services. As you've just said now, one of the most difficult positions at this organization, people that we want to look after, people that we want to be supporting because of the role that they're playing. So that's a perfect point for me, that I want you guys to start thinking about this the same way. The front desk term, it is a bit of a stale term. If I think about it, it's like, okay, the front desk person. But you have the power to make sure your team understands how important this position is to the success of your business.
And I agree. And one of the things that we've done, and I think it applies directly to this role at the dental offices, is I committed to making it the most enjoyable role in the company. And I'm not there yet. I have a long way to go, but I'm bringing support around them. I'm making sure they're not overworked. I'm making sure that they get breaks between calls, because it is incredibly taxing. And to me, when I think of culture, when I think of the front desk role, when I think of, this point role, I know it feels counterintuitive, but I am going to make it the best role in the organization for me if marketing is where I'm investing my time and energy and money. Because to me, one of the biggest problems, and we hear this from Susky all the time, is that it's not that they're rude on the phone, it's that they're rushed. And the
Mm.
problem is a rushed person sounds harsh, they sound impatient. And if I'm a new patient calling around, I have questions and I sense impatience, I'm likely to withdraw. And the insurance question gets a lot, and I think there needs to be training, and that's another one. But I think the first thing around it to build a great admin staff out of the front, or whatever we want to call them, is I think you actually have to prioritize it. And even the stories, one of the things I love from a book that is near and dear to us is Culture Built My Brand, is these stories we tell about our culture. I think it's safe to say, yes, previously the front desk was considered an entry level role for us. Now it's a sales role, and we're going to prioritize it accordingly. And so those
Mm.
stories don't apply anymore. And
Mm.
I love that because it honors the past, but at the same time represents this new future that I'm going to make sure that they get training. And, we're going to touch on training in a second. But to me, culturally, you need to clear their plate and make phones and answering the phone well their top role.
Mm.
And even pulling them, even I would say I love symbolic gestures. I think even taking them from the front desk and moving them perhaps to a back office, or even if something like that away from the front desk that can still answer phones, is symbolic in that, because I don't want them having to navigate. I have someone standing in front of me and this phone to answer. On a big enough practice, I want someone dedicated to the phone, and I don't want them distracted.
Especially when you're getting so many calls. Some
Mm-hmm.
of these practices I see in a month, they're getting 500, 600 calls. And if I'm having to deal with someone coming into the office and then also answering the phone, it does distract you. And as you were saying all of that, Eric, I thought to myself, maybe dentists are wondering now, okay, but why, Ian and Eric, why are you saying this is so important? Why must I change this? Why must I change the thinking? What we see here as a marketing agency dealing specifically with dentists, understanding what is going on the phones, having someone that can answer the questions correctly, that can field the questions correctly, that can deal with difficult patients, that has been the difference between a successful practice and a practice that's struggling, especially when you're fee for service or one of the practices
Mm-hmm.
that's not accepting
Mm-hmm.
all insurances. You can't just have someone that doesn't know what they're doing or doesn't know how to field these questions, because we see again and again and again with CallRail, which is the software we use with our practices to track calls. We see again and again, if you cannot answer these questions correctly, it's a 40-second phone call. You barely get a chance. It's ringing.
Mm-hmm.
Hello,
Mm-hmm.
do you take my insurance? No, we don't take that. Okay, well, thank you so much. Goodbye. Having a person that's trained, that understands the importance of this role, that can feel these questions and say, well, I just quickly want to tell you a bit about our practice and stuff. And that's where training comes in, and helping that staff know exactly how to do the things that are going to turn a new caller into a new patient at your practice.
I agree. We were talking about the why. When we turn on marketing, it represents an increase in work, and that increase in work on an already taxed, undertrained person, it makes marketing wasteful if you
Mm.
can't answer the phones. And that hurts me to say, because obviously I love big budgets, and I cannot lie. But if the phones aren't being answered well, you're going to get fired, because they're not going to see the return on investment. And any significant marketing improvement needs to be accompanied by a phone skills improvement, or having a quality phone skill at the office. And part of it comes with training. And whether it's front desk rocks, whether it's, a coach, whether it's in any other, All Star does great. ACT has some great, coaching.
There's so many resources out
There's
there
so
to
many
help your
resources.
team.
There's
So
so many resources.
you do
And
not
find
have
one
an
that,
excuse. You do not
Mhm.
have an excuse if you're a
And budgets.
dentist and yeah.
Yeah, don't come at me with budget. You can get support for a couple $100 a week, or a couple $100 a month, even perhaps. But having someone who is passionate about it, who's interested in training, even little things that self grades their own calls. Have your
Mm.
marketing team send them 4 or 5 calls a week. It can be at random for all I care. Just start the process, and have them listen to themselves on the phone. And interestingly enough, that's one of the ways that you and I've gotten better at this podcast thing. Is literally listening to ourselves. And it is
And it's tough.
frustrating.
It's tough. It's tough.
Man, it's
No,
tough.
we
I sound
know
like,
nobody wants to listen to their own voice, but you have to
mm-hmm.
force your team. If they're at the front desk, they need to do this. They need to do, because you'll start hearing, oh, I keep saying filler words, or I sound so blunt here, or
Mm-hmm.
I didn't
Mm-hmm.
handle that call. That's why you improve.
Even things like, I need a crown. How much is a crown? Oh gosh, let me talk to you about that. Why do you, before I get into the how much a crown costs, can you tell me why you think you need a crown? I would love to be able to
Mm.
talk to you. Dr. Ian is amazing. Oftentimes, we're able to come in and assess the tooth, and provide you from different options. And maybe you do need a crown, but can we just have a quick conversation about what's going on before I start rattling off numbers to you? Even that exchange has a likelihood to change the structure of the call to now they
Over
want to know
299.
more.
It's 299, and your exam is 199, and then okay,
Mm-hmm.
thank you
And the
so much.
crown's going to be $1,400, and
Yeah, for
yeah.
and
So all in, you're going to be 1,800. And even like, do you
yeah.
take my dental insurance? Okay. Hey, listen. Do you know you need some work done? Because if you know you need some work done, I want to talk to you about what those dental benefits cover. Because when have you ever been in love with what insurance has provided you? And Dr. Ian, he doesn't let insurance dictate your care. He's going to make sure you're taken care
Mm.
of. Even that, like now I'm in this conversation and this discussion around how to fit you into the practice, because dental insurance sucks. I mean, if you need a couple of crowns, who cares if you have dental insurance? Like,
You're
we can
paying.
work around that. You're paying. Yeah, you're
You're
paying.
paying, but the
Yeah, and
consumer
most
does
people
not
do.
understand that. They don't,
No, they do
and
not.
that's one of another. We were talking about training now. This is again why you need to be doing this to understand if the question comes up, can my staff answer this in a way where they are not necessarily bashing insurance companies, but they are helping the consumer understand what it actually means. All the implant offices out there, I hear again and again with specialists, people keep asking us about the insurance question, and then I try and
Mm-hmm,
explain to
mm-hmm, mm-hmm.
them that you're going to pay exactly the same amount as you would if you go to the guy down the road that accepts it, but they don't. I can't convert them. That is a perfect example
Mm-hmm.
of you need a playbook, and if that front desk team is not even conveying the message of you can go to the guy down the road, you're going to maybe save $200. What on
And,
a $25,000 treatment? I'm going to say how?
yeah, you're going to save $200. I've done 300 this year, and they've done 20.
Yeah.
So go save your $500. I don't know what to say at that point. Yeah, if you want to, if but even having the education question is, I think, important, and that gets to our third point. I think culture matters, training matters, and then there has to be accountability to the role. And the accountability is, if you're a Medicaid office or I accept many PPO insurance office, I think the culture and training of the front desk matter less, because you are an order taker. Do you take my insurance? Yes or
It's
no?
less friction. Yeah. Yeah.
Less friction. You're going to be there.
Yeah.
If you are dropping insurance plans, which you should be, if you are fee for service, if you are moving upstream into the treatments and procedures that you're
A
doing,
specialist practice.
specialist, you're the person answering your phones is first and foremost a sales position.
Yes. And I
And
like Eric, can you just say that again, please? So
the
they
person
understand
answering
this.
your phones is first and foremost a sales position.
There you go. There you
And
go.
getting behind the questions, taking the time, building relationships, having a follow-up process for when someone calls in and doesn't appoint. Hey, Ian, I know you're not ready to make an appointment today. I'm calling you back in a couple of days. Is that okay? Because I know, you said you're going to go talk to your wife. Hey, listen, I know what that means. I'm going to call you back in a couple of days and chat. Is that okay? It sounds like you got some dental problems going on. And while, yes, we're a for-profit company, I also want to help you out.
Yeah.
I love that language. And I think it's language that we all relate to. And
just what that made me feel compared to,
Mhm.
okay, let us know if you need anything else. Like, just just what I felt from the words you just said, and understand, and like dentists, and even if it's a front desk executive role person listening to this right now, remember that as human beings, we work on two things. It's fear or desire. And many times when we look at treatment acceptance, or we're looking at actually onboarding a new patient, somebody is calling out of fear or a desire to do something. So fear is there's problems. Like they have missing teeth, their mouth is falling apart, this is terrible. It's actually causing health issues to their body, and they are scared it's going to get worse. Then for my cosmetic offices, you have the other side of this of, I want to come in for whitening. Oh, can I ask why? No, I really want my smile to this. Oh, the results that we have seen with some of the people that came in here, it is the most beautiful smile. It just lights. So that's something that I want front desk people to also think about. You are playing a game of sales, as Eric just mentioned, and also a game of psychology. Just as any salesperson that's picking up the phone and calling
That's right.
you, anyone is playing. Why do you buy that thing that you definitely did not need? It's because they tapped into your emotions. And in this field, I mean, we're not selling you something you definitely don't need. We're selling you something that can change your life for the better, and you need to understand that.
And I'm going to jump to our last point and then come back to accountable. But like, they have to enjoy the game of sales. They have to enjoy the love of the job. That even that example of like, hey, Ian, I know what talking to your wife means, but
I'm being real.
I
Yeah.
care about you. I
Yeah.
care about
Yeah.
you, and I want to make sure you're going to be better. Okay. I'm playfully calling out that we all know that's a little bit of a lie. At the same time, I am demonstrating genuine care that I'm going to follow up with you in a couple of days, and I'm getting your permission for me to do it. And just by that exchange, I'm both demonstrating that I know what game you're playing here. Like, I'm a professional, but I'm doing it in a fun way. I'm not saying don't lie
Exactly.
to me. At the same time, I'm coming back to you at a later point because I know you're going to shop around. Something happened that is stopping you from appointing there. The phrase "I need to talk to my wife." For the record, I use that phrase.
Yeah, same.
All the time.
Yeah.
And
But then to
but
ask,
I'm
I mean,
demonstrating the accountability of it. But I think we have to have. Sorry to cut you off there, but I
no.
think we need to have incentives for how well my schedule is built, and whether it's how much money is on there, whether is it structured to what I want. But if we're talking about a sales role and we've invested in training and we've changed the culture, they have to have sales focused KPIs. And
Oh,
those
that's
KPIs
true.
need to be
Yeah.
incented. Yeah.
And I mean, with the tech right now, as I've shared about CallRail and all of these things, your marketing agency can help you to do this, or the person
Should
listening to
be
your calls,
helping
or
you.
should be.
Yeah.
And if you say, okay, I want to see how many calls Eric converted in the last quarter and for what treatments, it's very easy to put in place exactly what you just said, because that can then
Yeah.
incentivize my front desk person to say, oh, someone's calling in for implants. This one counts. This one, I need to pull it together. This one counts because I'm getting something at the end of this rainbow if it works out. And and that also helps your front desk then you're not treating someone calling in about a checkup the same as you're treating someone that wants to do a full arch.
I heard of a practice. I'll have to get it from Andre. He was talking about the other day, but like when they get an insurance patient call in, they schedule them, further out, and they keep a block specifically for
Block
cash pay
scheduling.
patients. Yeah, block scheduling, but they've taken it a step further. They do block scheduling, but they keep spots open for cash pay patients.
Okay, I've never heard that.
And
That's interest. That is an interesting
so
play.
if you call and you have, Delta or whatever, yeah, I have a spot open in about 3 weeks. Great, I'll see you then. But they're keeping cash pay patient spots available. Now, I'm not a lawyer. God bless them. I like it from a marketing standpoint, but I don't know. It doesn't sound illegal to me. I'm just choosing, when to see you. I'm not changing treatment or anything. But I like it because I am showing my front desk that I'm prioritizing cash pay patients, and they wrapped up incentives for the desk to fill those spots.
Oh, okay.
So
And then
so
then
so
again
not
it
only are they
encourages. Yeah.
structuring their thing, but now they're putting incentives behind it because I mean, we all know the power of a cash pay patient over an insurance, to and what it means to our practice. For me, when I think of this role in the practice, whatever you call it, there needs to be a cultural shift in how we talk about it, in how we staff it, in how we train it, and in how we hold it accountable. And from the way we talk about it to making sure that we invest so they have the training and the tools to answer those questions, making them accountable to the sales portion of it and clearing their plate of the non-sales portion that gets in the way. And then
Mm.
just making sure that the person loves the job. It's you're never going to be successful in a role that you don't love over the long term. And I'll give you a good example. Like I hate chasing people down for money. I don't like it. And when on our org chart, when invoicing was under me, it was fine, but like it wasn't the quality that is today under Andre. I mean, he just
Mm.
brings a level of interest and passion to it that I didn't have. And I think that's a good reminder for me that just because someone can do the job well doesn't mean they love the job. And you got
Mm.
to find someone that loves the sales job, loves the give and take, the banter, the playfulness of it, or however whatever their style is. But
Because it
when I
compounds. At the end of
because
the
it
day, it
compounds. Hmm.
compounds over how long are you planning on having this person at your practice? If I hate this job from when I'm starting, I compound in a negative direction. But if I'm excited about innovating and about chasing my incentives and about making a difference, anybody listening, and you and I included, we have seen examples of this again and
Hmm.
again and
Hmm.
again. When you have someone that is passionate about something over someone that's just doing it to do the job.
That's right. And for me, it's time to revolutionize this position and give it the same value that you would give a chair side and or
Hmm.
someone in the practice, because it is the biggest point of determining marketing effectiveness in the practice.
And you can pick if you want to picture that in a visual way. Think about everything happening on the outside, marketing wise, referrals, discussions people are having. I'm going to go, where does
Angry
all of
people
that
calling. Yep.
where does that come together at the
Yeah.
end of the day at that front desk? And I mean, that's all dentists need to understand. That's all you need to
It,
understand.
even the little soft things like someone calling in angry, taking the time to just have a conversation with them in a professional manner, not getting defensive, not debating points. Gosh, Ian, that must be really frustrating. You know what? Let me think about this. Let me talk to the doctor. Let me do some stuff. And let me get back to you. Okay, if you have a good culture, if they've been trained well, if they're accountable to these things, and they love the job, you're probably going to prevent negative reviews by this role too. It just cascades into so many areas of marketing that are so powerful of just having the right person, the right training, the right accountability in place. And I think more practices need to do it.
Perfectly said, Eric. Perfectly said.
Thank you. That's what I paid the big bucks on this podcast.
So are we summarizing it quickly?
I think you should.
Okay. So the first thing that we want dentists to do is to think how they are currently portraying and, if you will, the branding of the role at the front desk. Is it seen as it's something we also do, or is it something that you understand your team as a whole, that we need to support the people at the front desk? They play an incredibly important role, and also make sure that the people at the front desk understand how important the role is. So that would be the first point here. The second one is training. As Eric said, do not come and complain to me about I don't budget this. You can find resources online. You can find a coach. If you do have higher budgets, there are organizations that help your front desk in every single aspect of this, in how to improve and how to do everything you need to do at the front desk to be more successful. Accountability and incentivization. I would also like to bundle those together. Accountability. Are they listening to their own calls? Am I, as the dentist, listening to the calls? Am I understanding what's happening on the front desk? Are they doing the job that I'm paying them to do and excelling at it? And then the other side of that is, are there ways I can incentivize this front desk person that selling a little Toyota compared to a Lamborghini, I'm getting different incentives on how seriously I take these calls, and similar with if you think of dental treatments. So that's another one that you need to keep in mind. And the last one is being staffed well and someone that actually loves the job that they are doing. Am I coming to work? I'm happy to answer the front desk calls, playing a bit of a cheerleader for my whole team because I am that middle point. Am I going to compound into a positive direction over the years I'm at this practice, or is it going to be something I just do because it's a job I got?
Very well
And
said, Ian. Thank you.
that's
Yeah. All right. Well,
all right.
that was your bite of dental marketing. We'll see you
And
soon.
and turn it into action items, dentists. Don't just listen to us. Go and do it. It's going to make a difference.